Thank you, and thank you all for coming yet again to our annual meeting here at AAO. I have to thank our sponsors. We wouldn't be able to do this meeting without them. Thank you, and thank J&J for breakfast. And the Healthegy team. They've done this meeting now 24 times in different venues, and I think they do a fantastic job, and I thank them for all their efforts. Thank you. Thank you. This is how we've grown over the years, and you can see now we're in our 11th year, 11th meeting that's held just before AAO, and I thank you for that. As I said last night at a smaller dinner, this is your meeting. We've always tried to make it your meeting, and thank you for coming and doing it with us. Here's who you're sitting next to, a lot of industry people, big and small, some KOLs, and of course the financial people and all the service providers that you recognize. So how was this last year? Was it a banner year? I'd say a little bit, maybe in some ways. Let's see what at least my opinion would say. We'll start with the FDA as we always do. This is across the entire FDA. You can see it was a record year for new molecular entity approvals, the blue of the BLAs, 59. And of these 59, they were really high innovation approvals. Lots of orphan, priority review, fast track, breakthrough designations. You can see there what the FDA is prioritizing, what companies are going after. And a third of it was oncology, more than another third was rare and orphan, and there was one ophthalmology. So ophthalmology has normally one or two new molecular entities, but I would say relatively on the innovation scale, we're not knocking it out of the park, to be frank. Where were we across the ophthalmic drugs? Well, I mentioned last year that there was a reorg in process, where there'd be a separate division of ophthalmology. That is now approved and final, approved by Congress, and so we now have a separate ophthalmology drug division. So that's a great point, I think. Wiley's not here, but congratulations to him for that. There were 7 original NDA BLAs. One of those was a BLA. These are the 7. Some of them are repurposed drugs, so I can't mention all of them. I did want to mention iPoint's sustained release corticosteroid, fluocinolone, which I think is a good advance for chronic uveitis, non-infectious uveitis. And Bausch & Lomb has their modified Lotemax, which is a much smaller particle, much better anterior chamber penetration, and this is used for pain and inflammation after surgery. Rocklatan is the first combination product for glaucoma to use a prostaglandin agonist, and it's the first once a day. So I think in both of those senses, a real breakthrough, and Vincent Casey will be on stage at lunchtime to talk about and be recognized for that. And here is the one BLA that just happened 2 days ago, brolucizumab. I think really the first step into what is durable, sustained effect, if you will, if not sustained release at a 12-month label indication. So the now third approved anti-VEGF agent. So here are those new molecular entity comparisons. You can see across the entire FDA on the left, and you can see ophthalmology. We're represented, but I think we could do better. I think we need to identify more targets in the space to drug, if you will. Anti-VEGF has always been the biggest part of our drug industry, and you can see here it's continuing to grow. It'll pass $20 billion at some point in the near future. Most of these are delivered by intraocular injection, and the injections are just increasing dramatically around the globe. I apologize for the formatting on that, but you can see globally there are almost 25 million of these done a year. Most of them are outside the U.S., but a good third of them are inside the U.S. And I did want to mention a couple highlights specifically with regard to wet macular degeneration. Opthea had pretty impressive results, I will say, beating a standard of care anti-VEGF-A inhibition, and I think validated the point which they've been making for a number of years that C and D are important, and that if you have pan-VEGF inhibition, you can get better efficacy. So they're going to now be rolling into later stage trials, and we look forward to seeing what they show us. I was also impressed by Graybug, which has a sustained release sunitinib, also a pan-VEGF antagonist. And they showed durable control of vision and of retinal thickness on OCT over many months. 60% of patients were rescue-free at 8 months. So again, they're rolling into their phase 2Bs, and I'll be excited to see that data. Now, Kodiak is going to present here at AAO, and I think that'll be additional data. But again, their approach is to take essentially an anti-VEGF-A and then couple it to a much larger linker that effectively increases the size of the entire molecule by tenfold, and it through that way increases the durability and residence time. And they're getting, they say, durability out to 3 to 5 months in a mixed population they've studied. of wet AMD, DME, and RVO. At Verum, this is a gene therapy company. They're effectively delivering an AAV that delivers a aflibercept-like molecule, and they deliver it directly into the vitreous, which I think is a major advance if we can get that to work. And they've shown limited data on a small number of patients, but I think maybe there was 1 or 0 rescues. They say 0. They gave me this information. I heard earlier that one of the KOLs say 1, but let's assume what they gave me is what it is. There were 0 rescues in the 24 weeks of this study, which I think is impressive for a group of patients and eyes that required frequent dosing. Now, that compares to REGENXBIO, which also showed promising results, I would say, both as far as the concentration of the protein they're delivering. This is a Lucentis-like molecule that their AAV8 is delivering, but this required subretinal delivery. Now, Jeff Heyer, who's a personal friend, did, I think, if not all, most of the surgeries for this, and he's a phenomenal surgeon. And we all ask the question, what happens when it goes out into the general community? How scalable is this approach? So I was very happy to see that Peter Campochero's lab took their vector and showed that you could deliver it via a suprachoroidal approach. And then, not unexpectedly, REGENXBIO did a partnership with Clearside to actually bring that forward into humans. So I think, again, a lot of promise for a much easier delivery for that approach. So on the device side, there were 54 510K clearances that were ophthalmic among the couple thousand overall. There were 3 PMAs that were ophthalmic, and these are those PMAs. There was a femtosecond laser approved, the Carl Zeiss Meditex laser. There was a trifocal lens by Alcon, and then there was this iDesign refractive studio, so-called by AMO J&J. No de novo approvals in ophthalmology, although there were 29 across the FDA. Now, I want to just make a point about those approvals. One of the 510Ks and all of the PMAs, they all sort of touched on anterior segment, and at least 3 of the 4 on cataract. So the first I'll mention is MyLoop. This was acquired by Zeiss and is one of their products that they're advancing into the anterior segment cataract surgery. This is a much less dramatic approach to the lens fragmentation and removal than, say, phacoemulsification. And these are the 3 PMAs that were approved: the femtosecond laser, the trifocal lens, and then you can see the iDesign refractive studio. They're launched, they're being taken out, but I'll be interested to see how they do over time. I did want to mention a product that was not approved this last year. It was the year before, but this is being launched this year. And I mention it because I think it could really revolutionize the way we take care of patients who have cataracts. It's basically a lens that, when replaced, can still be adjusted without going into the eye postoperatively. And so I think this has the potential, as I said, to really change completely the way we think about adjusting lenses postoperatively and how good we can make patients' vision. So what about the funding? We touch on this every year. This is the NEI funding in blue over time. You can see it's up a bit, but in inflation-adjusted dollars in the yellow, it's kind of flat, as it has been now for many, many years. The good news is that the VC funding is through the roof. You can see here biotech in blue, devices sort of flat, but the biotech funding is just going crazy over years, and it's doing it in ophthalmology as well. Now, this is a complex curve, but I want to explain it. The yellow line is money raised by venture capitalists. The blue line is money invested into private companies, and you can see there's a huge delta, and it's increasing. So what that tells us is that there are many other players that are investing in these private companies other than venture capitalists, like crossovers, hedge funds, strategics, et cetera. And that delta has been growing every year. So that also is a good thing for our private companies. And when I saw this slide, this is the money that's going into ophthalmology, my first word was, wow. $1.5 billion in ophthalmology. When I started in 2000 in this industry, it was about 100 million. So 15-fold increase in annual funds coming into our companies for innovation. I think we should all be very happy with that. And as I said, it's an aggregate effect. So I was really happy to see that. Now, in the public markets, we have our OIS index, which follows many of the companies, about 30-some companies. We'll hear Michael Lockman talking about this later. Michael does a great job monitoring and updating this for OIS in the newsletter. Thank you for that, Michael. And you can see where it fits sort of in the device in black and a more standard biotech or index in red here. It's right about in the middle, and it's starting to slip down a little bit right now as we're approaching the election era. We'll come back to that. So how do these companies get out? Typically, they go IPO or they are acquired. Let's talk first about the IPO market. It has been robust, which is a good thing. It's been robust for ophthalmology as well. As you can see, the initial and follow-on offerings on this. But I would say if I were going to characterize the environment, it's jittery. People are not sure what's going to happen. You have global tensions with trade wars, Argentina, Brexit, et cetera. People just don't know what's going to happen with the election. What they do know is there's going to be a recession. It's not if, it's when. We always have a recession. And one of the best indicators of recession is the so-called yield curve. Every time this yield curve drops below zero, within 1 to 3 years, we have a recession, and it goes back for a very, very long time. It's a great predictor, and we just hit zero. So I don't know if we're going to have a recession in 6 months or 3 years, but it's coming. So get ready for that. And we're very nervous about the election. I think people are most nervous about the election, at least on the pharma side, because of prices and all the talk about drug prices and putting controls on drug prices. And I will tell you, as an investor, we think a lot about that, especially since we invest in phase 3 trials. We'll see. People have been talking about drug prices for 100 years, so we have headlines. One of my partners has a very interesting talk where he has headlines going back to 1910 about how drug prices are a ripoff, essentially, and we have to control them. We'll see what happens over time. What has happening right now, of course, is all these companies want to get out and go public before that uncertainty, before the elections for sure, and before all that chatter about drug pricing. So there's a huge queue. Every time I talk to bankers, and it's frequently, the queue seems to get longer. People want to get out by Thanksgiving because December is a sort of an off month, and if they don't make it, then they're looking at next year, and they'll be perhaps into that election cycle. On the M&A side, you can see here device in blue and drugs in yellow. There always have been more device M&As than drugs, but I would say they're perking along. I can't make too much of a statement on 1 year. The biopharma side, I think, continues to be active, and we do have many. Here's the biopharma sort of M&A spreadsheet, and the devices. You can see there are many more of them. They tend to be smaller deals, but the big companies are acquisitive. They're interested, and I think that's a great thing. Most of these deals are so-called contingent value deals. So you get an upfront, typically a third of the deal, and then you get sort of milestones and royalties or milestones and commercial-based milestones, and that's the other 2/3. And that trend has been with us now for a long time, even on the device side, and I think is here to stay. There are 2 mega deals that we all know about and heard about. There's the AbbVie possible acquisition of Allergan. I'm not sure what that'll mean for ophthalmology. I hope it's a good thing. I hope AbbVie's committed to ophthalmology. It sounds like they're going to be, but we will see. And then Takeda acquired Shire and then divested all of the ophthalmology. That was a great thing for Novartis because they got Xiidra, and I think they have one of the strongest ophthalmic franchises in the business now. But generally, I think it's a bad thing for ophthalmology not to have a strong company that was clearly innovative and acquisitive in our space. So. But this happens all again and again. It's part of the cycle. So that's my year in review. I apologize if I missed your company. I will expand this a bit before we distribute it. If you feel strongly that I missed you, please just let me know, and we'll see what we can do before we distribute out the PowerPoint. Stay in touch with us over time, please. And please come to the meetings. We now have 4 of these meetings annually. We love to have you here, and we love the meetings. So.